This video introduces the Measles and Rubella Strategic Framework 2021 to 2030. I am Dr. Seema Sharma, Professor of Community Medicine. Measles elimination is defined as the absence of endemic measles transmission for at least 12 months, with a well-performing surveillance system. Rubella elimination has a similar definition, also requiring the absence of congenital rubella syndrome cases associated with endemic transmission. The elimination or control of measles and rubella is critical because they contribute significantly to childhood mortality and morbidity. Measles also causes malnutrition, predisposes people to other infections, and serves as a key marker of immunization inequity. The Global Measles and Rubella Strategic Plan 2012 to 2020 aimed to achieve elimination in at least 5 WHO regions by the end of 2020. Key achievements of the 2012 to 2020 plan include the introduction of the second dose of measles-containing vaccine and rubella vaccination in various member states. Global coverage of both reached 71%, and surveillance improved. By the end of 2018, 82 countries had eliminated measles and 81 had eliminated rubella, averting an estimated 23 million deaths. We now introduce the Global Measles and Rubella Strategic Framework 2021 to 2030, or MRSF. The MRSF 2021 to 2030 was developed through extensive consultation, focusing on past achievements, major shortfalls, and defining strategic pivots. It aims to guide the development of regional and national strategies and aligns with the Immunization Agenda 2030 structure. The MRSF 2021 to 2030 requires several strategic pivots. These include shifting from a one-size-fits-all approach to approaches tailored to local challenges, embedding measles and rubella activities within immunization and other primary healthcare programs, and clearly defining stakeholder roles and responsibility. Additional pivots include shifting surveillance to be comprehensive and sustainable, strengthening capacity for outbreak preparedness, and improving cross-border collaboration. This framework also focuses on accelerating the use of innovative technologies for vaccine delivery and rapid diagnostics. These strategic pivots are key to the MRSF 2021 to 2030. The vision of the Measles and Rubella Strategic Framework 2021 to 2030 is a world free of measles and rubella. The goal is to achieve and sustain the regional elimination goals. Eradication represents the ultimate sustainable improvement in public health. Regional elimination is a step toward global eradication, but it is a fragile state that must be sustained to prevent reintroduction of the disease. The goal is to achieve and sustain the regional measles and rubella elimination goals. All 6 WHO regions have committed to achieving regional elimination, though specific targets and milestones vary. The MRSF 2021 to 2030 is structured around 7 strategic priorities, or SPs. The 7 strategic priorities are interconnected. They focus on primary healthcare and universal health coverage, commitment and demand, coverage and equity, the life course and integration, outbreaks and emergencies, supply and sustainability, and research and innovation. The strategy is underpinned by 4 core principles to extend benefits everywhere. It is people-focused, country-owned, implemented through broad partnerships, and driven by data. These principles apply to all 7 strategic priorities. Being people-focused means identifying under-immunized populations and communities, defining the root causes of under-vaccination, and ensuring equitable access to vaccination for all individuals. The country-owned principle emphasizes improving national and subnational ownership of measles and rubella efforts. It requires prioritizing and monitoring indicators and milestones, and ensuring all stakeholders are accountable for achieving goals within national health plans. A partnership-based approach focuses on establishing partnerships to maximize impact, accelerate progress, and promote sustainable delivery of interventions. This includes strengthening existing partnerships at the local level and involving the private and non-health sectors. The data-enabled principle involves generating high-quality monitoring and surveillance data. This data is used to monitor progress, inform decision-making, evaluate strategy effectiveness, and inform operational planning. Strategic Priority 1 focuses on primary healthcare and universal health coverage. Objectives include integrating all measles and rubella activities into PHC systems and enhancing surveillance as part of a comprehensive system. Applying the core principles to SP1 means integrating vaccination with other health interventions to increase community convenience. It requires government financing, using measles indicators as PHC performance tracers and coordinating with other health initiatives and programs. Strategic priority 2 is commitment and demand. The objective is to improve ownership and accountability for measles and rubella goals, as well as improve community demand for and uptake of measles and rubella vaccines. For SP2, a people-focused approach means engaging communities in designing responsive service delivery. Country ownership involves working with political leaders to build trust and advocate for vaccination uptake. Data should be used to identify root causes of low uptake and design tailored strategies. Strategic priority 3 is coverage and equity. The objective is to identify and address measles and rubella immunity gaps at all relevant points of contact. This involves establishing new contact points and using targeted approaches to reach underserved populations. Applying the principles to SP3 means considering the needs and perspectives of targeted populations. National programs must identify barriers to vaccination and implement sustainable strategies. Partnerships with organizations and CSOs should close immunity gaps, and data must inform planning and monitoring. Strategic priority 4 is life course and integration. Objectives include using the life course approach to deliver the second routine dose and catch-up vaccination, and integrating measles and rubella activities with other health and non-health activities. In SP4, the people-focused approach uses the life course and integration to provide opportunities to close immunity gaps. Country ownership means developing national policies and plans for catch-up vaccination. Partnerships strengthen life course platforms, and data is used to identify immunity gaps and integration opportunities. Strategic priority 5 focuses on outbreaks and emergencies. The objective is to ensure outbreak preparedness for timely detection and effective response, limiting the spread of measles and rubella and reducing related morbidity and mortality. For SP5, being people-focused means considering vulnerable communities in planning. Country ownership requires developing national action plans to strengthen local capacity. Partnerships, including the humanitarian sector, should be harnessed, and outbreak data must be used to strengthen routine vaccination. Strategic priority 6 is supply and sustainability. The objective is to ensure the availability of high-quality measles and rubella-containing vaccines, supplies, and laboratory reagents. It also aims to sustainably finance all related activities, including surveillance. Applying the core principles to SP6 means allocating supply and financing to meet the needs of all populations. National governments are responsible for financing, ensuring supply availability, and working with partners for sustainable financing. Data from logistics systems must ensure timely distribution and inform budgeting. Strategic priority 7 is research and innovation. The objective is to foster research and innovation to overcome barriers to achieving high immunity. It also aims to generate and use high-quality disease and program data. For SP7, research and development must reflect community needs and priorities. Countries should strengthen local research capacity and evaluate innovative approaches. Partnerships are crucial to developing and scaling up innovative technologies. Data informs research on unmet needs and programmatic barriers. Thank you for watching this video on the Measles and Rubella Strategic Framework 2021 to 2030.